times in our emergency rooms, but what if you could avoid the wait and still get the care you need?
Yeah, so joining us now to talk about the services offered at urgent care centers is Dr. Jonathan Thierman, President and Chief Executive of Expresscare Urgent Care Centers, which are part of course, LifeBridge Health. So good morning, Dr. Thierman. We so appreciate you being here.
Happy to be here.
So we want to talk about, because I feel like you have a very interesting perspective in that you trained and practiced as an emergency medicine doctor, and now you run these urgent care centers. So what is your advice for patients seeking this kind of care?
Yeah, I mean, I spent a good 10 years of my life on the front lines in the ER, seeing patients that came in both very sick and somewhat sick. And you know, the ones that were somewhat sick that didn't necessarily need emergency level care would wait many, many hours for that care. So moving now into urgent care, I see that we can provide access to the community much quicker, much less expensive. And so my aim now is to provide access for all those people who otherwise might go to the ER, but would be better served in an urgent care setting.
And talk to us about the multitude of services available, because sometimes people don't even realize that there's a lot that they can get done in urgent care.
Yeah, I think that's one of the issues, that people don't know what we can do and what we can't do. So we have x-ray. If you break a bone, we can set the bone. We can put you in a splint. We can sew a laceration if you get a bad cut. We treat all sorts of respiratory infections, ear infections, eye infections. We do UTIs, pretty much anything that's not serious enough, such as a heart attack or stroke or severe abdominal pain that might lead to a surgery. Those things are best served in the ER. Almost everything else we can do in urgent care.
Okay. And what about the benefits of going to an urgent care versus if, you know, going directly to the hospital?
Yeah, well, at Expresscare you can sign up online, so you can reserve a time slot and get seen within that time period. If you walk in, you're also seen pretty quickly. So what might have been a 6 or 8 hour wait will be a 20-minute wait at urgent care. And the cost is much less expensive. So I think the other barriers that people don't realize, even if they have Medicaid, even if they have Medicare, the ER is still more expensive. And if they get free ER care, they're most likely going to get free urgent care as well based on their insurance.
And is there somewhere people can go online to find out more about Expresscare or find a location near them?
Yeah, our website is goexpresscare.com, and we have all the information there. We also do quite a bit of telemedicine, so if people feel too under the weather to get out into their car or to walk to the nearest one of our locations, they can, from the same website, goexpresscare.com, go to telemedicine and see us virtually.
That's a great benefit. Okay, thank you so much for the information, Dr. Thierman.
Yeah, my pleasure.
Appreciate it.
Great to be here.